Thank you to Taco Gringo for supporting episode 2 of the You Matter podcast, You Matter IL. I am Mo, the host of the Third String Morning Show, 97.7 QLZ. And joining me on screen from the American Foundation of Suicide Prevention, Illinois chapter, Angela Cummings. How are you doing?
I am great. That is a mouthful. Thank you for getting all those words in there. Thank you. I appreciate that.
I'm going to try my best. I'll do your intro if you do our guest intro.
Okay, that sounds good. And I'm not even going to try to do her intro fully because she's got a lot of letters after her name, which means that she's totally a smarty pants and the perfect person to be on this podcast with us. She is one of our Illinois board members, and she also is the director of the Wellness Center down at SIU Carbondale. She is Beth Morrison. Thank you, Beth.
Hello, thank you for having me.
So this is our first attempt at a live stream. So if you are watching it live right now, you are welcome to interact with us, ask your questions. We're going to try to keep it on topic. And this week is something that, well, I'm affected by. Actually, this week, Tuesday, was a rough day for me, to be honest with you. Seasonal affective disorder, seasonal depression, however you want to call it. Beth, you're the expert. You're the pro on this one here. Is this common? Do a lot of people suffer from it?
It actually is very common. And for those who are already diagnosed with a type of depression, it actually will affect about 70% of those who are already diagnosed with a depressive disorder.
Wow. Okay. Yeah. And is this something we're born with? Is it genetic? Is it something we develop, or?
Yeah, there is a genetic predisposition for this, but sometimes it really won't get diagnosed until your early or late teens or early 20s. But it definitely is a type of depressive disorder. So it's not really like a standalone disorder. It really is linked with depression, but there's a pattern to it. So with seasonal affective disorder, typically those who are diagnosed with this really experience significant changes at the start of either, the winter months, which can last into the spring months. There is, however, a small population of folks who will experience seasonal affective disorder in spring and summer. So that's a very small population, but it really can, affect multiple people. We see it more in women than men, and usually at younger ages rather than older ages.
I will say that summertime seasonal affective disorder, I spent 40 years in Texas and in the extreme heat. And, people here in the Midwest think, oh, Texas is warm. How nice. And I used to get kind of the summertime blues because right around June, it was starting to creep up towards 100. And I had the sinking feeling, realizing that it was probably going to be over 100 for the next 4 months. Not pleasant to go outside. Ridiculously bad mosquitoes who had West Nile, so it was just like I kind of got the summertime blues almost, because same kind of situation though, probably not being able to get outside, not being comfortable outside. Going outside was like a battle of sorts. Like if I make it to this party without being completely drenched in sweat, it's a miracle. I'll bring a change of clothes. So I guess I can see it's just sort of dealing with like the harshness of whatever the environment is may kind of plunge people into those bad feelings, I would think.
Yeah, definitely. And any changes in the temperatures or the seasons can also bring a change in our body clocks. So our circadian rhythm can be thrown off, and that can impact our mood. So any changes in serotonin levels, so not getting into the sun and not having our bodies produce the vitamin D that we that we really need, can actually impact our mood, as well as sometimes when you're in the sun or not in the sun for long periods, the melatonin in our body can increase, which creates, sleepiness and feelings of lethargy. So those are all contributions to it during the changes in season.
Now, of course, we call it seasonal affective disorder, SAD, which I'm sure they planned that. They had to plan that. But that's what people think, though. That's typically the first sign, is that people are sad. But I'm sure that's not the only sign that somebody could be suffering.
Exactly. No. And, we do hear those phrases like, oh, you've got the, winter blues. Let's try and beat the winter blues. It's actually much more than that. And it really takes either, self-protective factors or treatments, medication to really help with it. But oftentimes it will involve, like you said, the low mood, but also low energy or feelings of fatigue, withdrawing from things that you might normally enjoy. It has even led to suicidal thoughts in some folks, and just really feeling down and no energy. And it could even, lead to changes in weight or sleep patterns. So a lot of the symptoms that we see with depression.
Mm-hmm.
And is there, in your expertise, how do you get ahead of it? Like, for instance, I have an ex that I dated years ago. She and I are still in good terms here years later. She is now engaged to a new somebody. Before they got engaged, there was doubt. She had doubt that he was going to be able to put up with her throughout the course of the winter because of her depression. She's like, well, let's see if he survives my depression. She acknowledges it. She knows it's there. Is that a step in the right direction? Do you have to do more? Like, she's like, it's going to happen. We all have to deal with it. Can she do more?
Well, I think it's great that you're able to, or she's able to identify it. That's the first step, is to actually recognize, wait a minute, something's happening here. This isn't feeling like I normally feel, but then planning ahead. So there are steps that you can take to really plan for the season changes. And some of them can be, fairly simple. I know of some folks who've created like a sun or light room in their house, which, they have bright colors. They don't have, dark room darkening shades. They might put some sand tray or bright lights, or even light box therapy. So there are preventative things that you can do. And the more that you can, I think, track your mood and start recognizing when the changes, happen, to discuss it with your partner, with your family. But then that's when it's important to, fill your toolbox with some self-care strategies and things that can actually help lift your mood.
I subscribe to the New York Times Sunday edition, and I don't know if anybody else who's watching or listening does, but their travel section turned into the at-home section because nobody was able to travel, and a lot of their the at-home section actually has turned into a really good like mental health section as well too, because it's all about things that you can be doing to make up for things that were lost, to make your home comfortable, to make yourself comfortable, to uplift your mood. And they were saying that now, especially during the pandemic, this seasonal affective disorder might even be worse because the things that you might normally do to kind of pull yourself up out of it, like go to a bar with your friends or go to a live music show, those things aren't even available now. And so it's almost even harder to find activities that can pull you out of it as you're kind of finding yourself sinking into it. They had like a lot of good strategies, little tips that, they said now more than ever is probably the right time to invest in good winter gear so that you can go to these outdoor beer gardens or, make a hot cocoa mug and walk around the park with your friends. You're going to probably have to be outside if you're going to socialize. And this is probably the time, if you've never really, invested in a good pair of winter boots, this might really be the year to do it. Anyway, it's just some interesting tips there about how, even if you're not someone who has a clinically diagnosed seasonal affective disorder, that we're all going to be feeling it a little bit because, on top of being stuck inside for weather reasons, we're still kind of stuck inside for pandemic reasons. So just some really interesting tips there.
Yeah, and along the lines with the pandemic. So anything like the pandemic, like the election, anything that's creating more stress is just going to exacerbate or increase the symptoms for someone who has seasonal affective disorder. So, the symptoms that they might even be used to might seem even worse now because of everything that they're dealing with, and the isolation, like you pointed out. And we are seeing, increases in substance misuse, alcohol use. So those are things to maybe watch out for as well. And, especially during the winter months where we talk about, I packed down a few pounds, or I've, reached the COVID-15 or whatever. There's something to carbs. So if you're wanting those chips and you're finding you're eating that whole bag of chips, carbs, our brain, it signals to our brain to produce more serotonin when we have carbs. So that's why we might start craving these carbs. So be mindful of that. It could be because you don't have enough serotonin. So not just that you're binging or whatever it might be, but or have no willpower, but it could really be that your body is wanting that serotonin, and the carbs help with the tryptophan. It helps release all that and create more serotonin.
So interesting.
We learned something on the show as well. I mean, I like to promote. I'm not an expert, but I've suffered from mental illness for many years, and I'm very open about the discussion. And I didn't know that about the carbs, which makes a lot of sense because at work, the stress is up, the staff levels are down right now. I mean, there's a lot of tension in the world and specifically at work. So I find myself eating potato chips.
Yes.
A lot of the carbs, and I'm not going for the sweets as much. I'm going for the salty stuff, and that makes perfect sense. And I thought it was maybe just because it was like a distraction. I was going to say healthy distraction, but it's not really healthy. But it's kind of helps me stay focused. I just keep eating the chips, but that makes a lot of sense.
Yeah. And so to your point, Angela, what you were describing, even having things like, or talking to your doctor first, but about the right amount, but having vitamin D. So, that's so important. And also it's shown to maybe help somewhat with the coronavirus. I'm not sure. I'm not a doctor, but I've heard those things. But having some vitamin D, and also what we have here at SIU, we have a stress management lounge for the students, and we have a light box. So light box therapy has actually been shown to be effective in treating seasonal affective disorder. It mimics the sun's rays. So your body responds to it by producing more serotonin. So even 10 minutes in front of a light box a few times a week can show to be significantly helpful.
I've also heard that cognitive behavior therapy can help as well, where you're just really kind of trying to reset the narrative. I mean, I wore these costume effects here just to kind of, point out, see, things can be cozy. You can look at things a different way. It's gray, it's dark, it's cold outside. On the other hand, my hat and my scarf and my little gloves are cozy, and my tea is cozy. Maybe if you just start reframing the way you think about it, it's like, oh, and a fire is cozy. And so it's really like purposefully and mindfully mentally listing all the good things about cold weather. This is nice. I'm going to get to snuggle on the couch and things like that. I get to play in the snow. So really being mindful about, pinpointing things that might be a positive about cold weather.
Exactly. Because a lot of times, just the thought of winter coming on or the change in the season for someone who has a pattern, and for someone who's been struggling with this, automatically triggers this thought of, oh, here we go again, or, oh, this is going to be horrible for me. So exactly, reframing those thoughts into something more positive, and it's starting to develop new associations with winter months or with the fall, reminding yourself of maybe someone that you can spend more time with in the fall, or plan to, and do more, fun activities in the fall than you used to. So yeah, developing new interests, new hobbies can all be really good strategies. But definitely cognitive behavioral therapy is one of the effective treatments for seasonal affective disorder.
We do have a lot of comments coming in. I didn't want to interrupt anybody talking here. Laura's thanking us, loving the discussion here. Bobby doing the same thing. He's saying a lot of people have this as a problem, don't know where to turn. Robert saying we're all the best for helping out. Tammy offering a suggestion of starting an indoor garden. I've heard that the indoor plants are big too. And then Dan says he has a question about carbs, please. So Dan, if you can go ahead and type up that question, I'll be more than happy to put that on the screen so Beth, our expert, can answer that. But I actually want to rewind just a little bit, Beth, and talking about the light therapy. How does that work? Do I just stand in front of a light, closing my eyes for 10 minutes? Like how? It sounds like a basic question, but there's probably a lot of people that don't know how this works.
Yes, and there are a lot of light boxes out there. You can just go to Amazon and search light box, and there will be a whole, 100 or so of these light box pop up. So you want to make sure that you do your research. And for us, what we did is we researched with the Mayo Clinic and went with their recommendations. And so you want to get one that is not going to be damaging to your eyes or anything like that. And there are some contraindications for using light box therapy if you have some eye disorders, or if you've been diagnosed with schizophrenia, and if you're on certain medications, then you might not want to use one. So you definitely want to do your research on this. And yeah, so what you do is, and they will have you sit like so many feet apart from the light box and not look directly in it.
All right,
But
so
yes,
you're not right here. Okay, that's
yeah,
good.
so we suggest to students that they read or do their homework. That would be an opportunity. But so not looking directly at it, but then just sit in front of it for about 10 minutes. And we say, at least 3-4 times a week. That's what the recommendation is to see an improvement.
Okay. That makes a lot of sense. So Dan followed up and he wants to know, he goes, my wife and I just started a low carb lifestyle. What do you recommend in place of the carbs to help with serotonin?
Well, again, just talking with your doctor, definitely recommend that you talk with your doctor, because adding vitamin D or foods that are rich in vitamin D, leafy greens, so those things can be very helpful. And replacing that, because also remember too, with the carbs, although you might get a boost in energy, you're going to come down, it's going to hit you pretty quick with the downward slope of that. And then you're going to be tired pretty quickly. So, it's more of a temporary fix or a Band-Aid fix, but anything rich in vitamin D would be something to talk with your doctor about or a dietitian about.
Absolutely. And something that I think Angela, you and I are probably going to bring up every single week is, it's okay to feel off. If you are feeling depressed or down right now, it's okay. Don't beat yourself up mentally or physically about it. We're all doing the best we can right now. And I posted something on my Facebook page just a couple of days ago that right now, a new term going around, emotional exhaustion, is happening right now. And there was like 8 different signs that you are going through. And I think I had 7 of the 8 of them myself. It's trying for everybody right now. So don't be upset if you don't have all the perfect answers in your world, or if this podcast isn't giving you everything you need to get you, 0 to 100. It's a task, but it's a task. As long as we're fighting it, we're on the right.
That it's okay to not be okay. That's the phrase, and I'd like to think that certainly in this last year, and then all the work we've been doing with AFSP and a lot of other organizations as well, we've been sort of erasing or minimizing that stigma associated with just admitting that you're having a bad mental health day, or that you do suffer even from an ongoing mental health issue. But Mo, as you've talked about, it's not going to go away just because you deny it and you don't talk to people about it. In fact, it's probably going to fester and get worse. So if you feel that creeping in, kind of dark cloud creeping in, it's better to do something proactive. Just start running through the things make you feel better. Take a bath, take a walk, call a friend, eat some carbs, take a nap, whatever, in the immortal words of the poet Trent Reznor, you need to be up above it, not down in it.
Yeah,
you have 3 rockers in this conversation. We all appreciate that.
But really, if you can kind of, as Mo, you've said before, if it spins out a little bit too far ahead of you, then you actually have lost your ability to bring yourself back to center. And then that's really when you're in trouble. So just kind of being proactive and asking for help and reaching out to your network when you know that you're starting to feel really bad. Just saying, I'm starting to feel really bad. Can anybody talk? Anybody want to Zoom? Anybody want to go for a walk? Things like that.
And Beth, what happens if you have a friend, a loved one, a family member who is struggling, but they are not opening up about this? What can we do to help?
Just check in with them. And I think a lot of the times it's just letting them know that you are there. Hey, I'm here. And I think so many times we ask the question, well, what do you need? What can I do for you? Well, in those moments, they might not know, or they don't want to have to think about if they knew what they needed, then they might be able, they might have already been doing that. So it's really good to be proactive and just go there or listen or call the person, touch base with them frequently, send them, a GIF or something that's just uplifting and motivational, funny, using humor, try and get them to laugh. Offering to, I know with COVID it's difficult, but maybe you can do a virtual coffee or something like that. Or watch a funny Netflix series or something together through Zoom, and then comment on it while you're watching together. So just be there. That's the most important thing is, when they say, I just need some time, that's fine, but check in with them. Don't let, a week go by or even a few days go by. Check in, do everything that you can to try and be there for them.
I love that. I absolutely love that. And I can speak firsthand. Don't take it personally if you are reaching out to someone. How can I help? I don't know. I'm not sure. Don't take that personally. That's not something that, as Beth just said, you may not know the answer. I have my moments where I'm down in the dumps. Oh, hey, Mo, how can I help you? I don't know. And then people get upset, and it's not the point of it. I am very appreciative when anybody reaches out and wants to know how I'm doing. Because that right there goes to show that the world is a better place than it's often portrayed to be.
Yes. And there are great, caring people out there who want to help you through it. So don't be afraid to reach out.
Absolutely. Absolutely. So we know that seasonal depression, the affective disorder, can be year round. But again, as we said, typically fall into winter. So is it typically around springtime where maybe people start livening up again? Is there like a specific month or day or?
It usually starts in the spring when the days get longer. So when we have that, spring ahead. So when the days start getting longer and the sun is out longer and we're able to get out and do more things, that we do see a lift and a change again in that pattern. So, sometimes people say, well, you just need to get through these 3 months, but you shouldn't have to just get through. Yeah. You should be able to enjoy yourself during this time too, and not have to, just be existing. So, right. Yeah. So I think there are many things, and even something as simple as meditation, which really doesn't cost anything. That's something I'm a huge proponent of, mindfulness. There are a lot of different types of meditation that are quick, just 4-second breath meditations. They can help you, focus just on the present. And like you said earlier, it's okay to not be okay. It's okay. It's okay if you're feeling sad. Allow yourself that. There are some healing properties in tears. So it is okay to have, sometimes when they say you just need a good cry, there's some truth in that, because there are some healing properties there in the chemical makeup of tears. So it's okay to not be okay and to allow yourself that, and not force yourself to feel something that you're not. But also recognize that and do whatever you can to maybe just take some pleasure in the day and however you can.
Distractions can go a long way. Yes. And especially here, 2021, we know things will get better. The pandemic will subside eventually. We're not there yet, but I think if we can all just look out for one another and keep building each other up, I think that's really going to help all of us out. Beth, kind of put you on the spot here. We obviously have the website that we put at the bottom corner. Is there anywhere else, any other resources that people can look into to learn more?
Sure. So, of course, the American Foundation for Suicide Prevention has a lot of different resources on their site, but also NAMI, so National Alliance for Mental Illness, they have really good resources. The Trevor Project for LGBTQ folks out there have some wonderful chat rooms and resources. So, don't hesitate. Feel free to search the web for something that actually works for you. And even on Facebook, you can find some really good depression groups. So don't feel that you've got to be alone in this, because you definitely are not.
Absolutely. Angela, anything else we should mention before we wrap this up here?
No, I mean, I think Beth pointed everybody to the good resources that are out there. The National Institute of Mental Health also is another one I might mention that has, if you just, Google NIMH, you'll find all sorts of resources there as well. So that could be another one just to look up. But I think she's right. Just reach out and look around. And if there is a silver lining to the pandemic, at all. It's that, we've all figured out that we can do a lot of things virtually now. We can meditate virtually. We can be part of yoga classes virtually. We can do meetups virtually. So, and we can have, I think teletherapy, actually, they used to think that wasn't really going to be effective, and the insurance companies weren't wanting to pay for that, for example. They thought, no, that'll never work. And once it became the only way to deliver therapy, it turns out it's working great, and more people than ever. I read a statistic recently that mental health therapy increased, far greater rates than like regular telehealth medicine. So there are some silver linings. And again, that's just that cognitive behavior therapy. Like, you have to reframe it. I think, there are resources out there, and now more than ever, they're easier to find, easier to, get involved in, and you're home all the time. So it should be easy to make time to do it.
Yeah, and one last thing that I would just like to say too is to always just remember to be kind, be patient with yourself, and be compassionate towards yourself, because you are struggling, and that's okay. And you will get through this, hopefully with the help of other supports and people that you care about and care about you.
And anybody that listens to any of my programs or podcasts know I will drop everything and make myself available to have a discussion if you are struggling. Not a pro, but I've been there and I understand. So, and I'm pretty sure Angela's the same way.
Absolutely.
I've known Angela for years now, and I know how giving she is. Beth, I've just met you, but I'm willing to bet you're a person to do that too.
Yes.
Yeah, anytime. Those of you interacting live, thank you. Those of you watching or listening on demand, feel free to still comment. Feel free to ask your questions, and we will do what we can to help. Next week on the You Matter podcast, Angela and I will be talking about senior citizens and depression and how it affects that age group. So if you have any questions, get them ready as well. Angela and Beth, thank you again for your time today.
Wonderful discussion.
Thank you so much for having us.